Hey everyone, welcome to the MMOA podcast. My name is Kay Mayordomo. I am an outpatient physical therapist and a TA with the Modern Management of the Older Adult Division of ICE Physio. So today I will be going over whether or not the ACSM exercise recommendations are enough for patients with osteoporosis. So some of our patients may be wondering, well, I'm an older adult with osteoporosis. Do these recommendations apply to me? Is it enough for me to make a change in my bone mineral density? And after this podcast episode, you'll know exactly what to tell them. Sometimes in the clinic, we are fighting tooth and nail just to get our patients to do any kind of physical activity. So, does using ACSM exercise recommendations help us in this fight against inactivity? There was a systematic review and meta-analyses done particularly to answer this question. But first, we'll review the exercise guidelines that they had for physical activity, and then we'll summarize that systematic review, and then we'll go over how we can use this in the clinic to relay to our patients. So, the exercise guidelines from ACSM are these. So, first, they have cardiorespiratory exercise. They recommend doing this 4 to 5 days a week, moderate intensity, 40% to 59% of VO2 um, resting heart rate. And they're saying that you want to get the patient to start gradually increase them from 20 minutes to at least 30 minutes and up to 45 to 60 minutes for each session. The resistance exercise they're recommending is 1 to 2 days a week of non-consecutive on non-consecutive days, gradually increasing to 2 to 3 days a week. They're saying that you want to adjust the resistance with the last 2 sets being challenging, and high intensity training can be performed if tolerable as well. They're starting off with 1 set of 8 to 12 repetitions, and you're increasing to 2 sets after about 2 weeks, and then you're performing no more than 8 to 10 exercises per session. They also recommend flexibility exercise, but that's not the focus of what they are looking at in this systematic review, so we're not really going to talk about that. So, in this systematic review, they included published randomized control trials. Subjects had osteoporosis or low bone mass. Interventions could be any land-based exercise program, including resistance training, aerobic exercise, flexibility, etc. And the control intervention could either be no treatment or any treatment that's not exercise. And they had to have reports of bone mineral density at lumbar or femoral neck, and bone mineral density was determined by dual energy X-ray absorptiometry or dual photon absorptiometry. So, what the systematic review found was that compared to exercise with load, uncertain adherence to ACSM recommendations. So let's say the exercise program that a patient is doing isn't quite following the recommendations. Compared to exercise with high adherence to ACSM recommendations, the exercises that follow the ACSM guidelines to a T tend to have a more positive relationship with lumbar spine bone mineral density. It didn't say it was that significant though, so we kind of have to be cautious about that finding. But more significantly, they found that with any exercise, there was definitely more of a significant change with femoral neck bone mineral density, and especially more so when you adhere to the ACSM guidelines. So the systematic review definitely said that these results should be interpreted with caution, and usually, as research says, further research is recommended to really gain a comprehensive understanding of the impact of ACSM guidelines and to determine its role in different populations. So, we're going to talk about this more later, but I think there's definitely a role for ACSM guidelines for the general population if we're just trying to increase their physical activity. But in certain populations, it's definitely important to be specific. So, after reading the systematic review, did a little more digging, and we definitely know a lot. There's a lot more research that's more specific to osteoporosis. What I did find that was that ACSM does have published guidelines for physical activity and bone health. And what they recommended was that healthy adults must perform a jumping exercise, a weight bearing aerobic exercise for at least 3 to 5 days a week, and resistance exercise at moderate to high intensity for 30 to 60 minutes per day for 2 to 3 days per week to maintain bone density or bone health. Um, the key recommendations in that guideline are that individuals with osteoporosis or osteopenia should undertake resistance and impact exercise to maximize bone strength. So, resistance training 2 to 3 times a week, one set of 5 to 12 repetitions. And they did recommend a combination of free weights and machines, and including exercise, like 3 to 10 exercises in major muscle groups at 50 to 85% of 1 rep max for 3 to 12 months. They recommended impact exercises, including things like drop landings, jump rope, jumping chin ups, and they were saying that for jump roping, at least 50 jumps per session for at least 6 months with 3 or more days per week. And they were saying that, moreover, weight-bearing aerobic exercise, balance training, and just habitual physical activity prevented further bone loss, maintained or improved bone mineral density. I'm sorry, I'm so tongue-tied today. And reduce the risk of falls in the individual with osteoporosis and osteopenia. So, how can we relay this to patients? It really depends, I think, on what the current struggle is with your patient or what you're trying to accomplish. So, of course, the answer is it depends. If the main issue is that your patient isn't getting any kind of exercise at all, let's start with the ACSM recommendations and just trying to gradually get them to hit those recommendations. If the patient wants to level up their bone mineral density gains, then we have other studies that are so much more specific about loading heavy for osteoporosis, making sure to include impact exercises and also power training. So this may be where we say, hey, you've done an amazing job at keeping yourself active and incorporating resistance exercise, but here's how we can really be specific in making a change in that bone health. So, looks like you haven't seen the change you want to see. Here's this, and this recommendation to help get you there, and have them build up to tolerating working at 80% of their 1 rep max, making sure you incorporate the impact training that's tolerable for them, and incorporating power exercises like a clean, a snatch, a jerk, that kind of thing, or push press into their routine. The particular systematic review we looked at today definitely looked at a different aspect of osteoporosis and exercise, but we have tons of other research supporting heavy resistance training, impact, and power exercises for osteoporosis. So, the systematic review is both telling and also tells us what most research says. We need more information. Our overall ACSM recommendations for exercises are 4 to 5 times a week for cardiorespiratory exercise. That being moderate intensity for 150 minutes a week, or vigorous activity for 75 minutes, resistance training 1 to 2 days a week, non consecutively, and then increasing that to 2 to 3 days a week. Um, the systematic review pretty much showed that for lumbar bone mineral density, the closer the exercise adhered to the ACSM guidelines, the more significant the effect on lumbar bone mineral density it had. And for the femoral neck bone mineral density, regardless of whether exercise adhered to ACSM recommendations, the femoral neck bone mineral density still improved, but definitely more so when you adhere to those ACSM guidelines. So when we take this info into the clinic, we have to recognize who the patient is in front of us. Is it somebody who is super sedentary, doesn't have a regular exercise routine, isn't making the recommendations for physical activity at all, where maybe the main goal is even just to meet those guidelines? Um, maybe this is where we start. Just, hey, here's how we can start to increase your physical activity. The goal is to try to meet these guidelines as close as we can as a minimum. If you have a patient who is ready to and willing to load heavier because they have been strength training, they have asked you, how can we be more specific? Then this is where we can really get them to tolerating 80% of their 1 rep max for resistance training, impact, and power exercises. Obviously, there's a bit of and, not or, depending on what the patient is agreeable to. So maybe for that person who's more sedentary, they're okay with adding impact exercises, but they're like, I am not lifting heavy at all, I'm not ready for it. Then you're just taking what you can get at that point. So whatever the patient is agreeable to, that's kind of where we can start. And obviously but overall, the main goal and message of this article, I think, is that even following ACSM exercise recommendations, even though it's not as specific as some of the other articles we have out there for osteoporosis, like the Lift More trial, or the ones about power, or the ones about impact, or the other guidelines we have, it's still better than nothing. But let's see what the patient is willing to do with us, and we can make gains that way. So hope you enjoyed that podcast. I hope everyone has a good evening. I'm just going to leave you with our upcoming courses. So MMOA Live, we have one coming January 18th to 19th in Hendersonville, Tennessee. January 25th to 26th in Athol, Idaho. Hope I pronounced that correctly. And February 1st to 2nd in Carson City, Nevada. MMOA Level 2 started last week. We're into the first week of that. And MMOA Level 1 starts today, but you can still definitely sign up for that if you are interested. Shout out to Mike Stetter, I think that's how you pronounce your last name, for your comments on the podcast. And see you guys on the next one. Bye.